Hello, my name is Sarah Barron. I'm a professor at Central Oregon Community College, and this is an interview that really talks and looks at the Oregon marketplace. We're going to be talking about the following: what is the marketplace and who is it for? How to navigate the marketplace, how to reach an insurance agent, and then specifically tips for community health workers or someone who wants to connect people to the marketplace. And this interview will be helpful for those people who are also interested in navigating the marketplace. I want to highlight that for more information, definitely contact Carolyn Black. This is the person that I'll be interviewing. She is the Outreach and Education Coordinator. She is the person to contact if you're interested in becoming an assister, and also for more information on how to navigate the marketplace in general. She is the person who I'll be interviewing, and I'm excited to get this started. So let's start the interview with Carolyn Black.
Absolutely. Thank you. So my name's Carolyn Black, and I am an Outreach and Education Coordinator with the Oregon Health Insurance Marketplace. I specifically cover Lynn, Benton, Central Oregon, up into the Gorge. So Sherman, Gillum, Wheeler, Wasco, all the way over to Hood River. And I've been with the marketplace since 2013. So I've been here for 8 years. I love what I do. I'm originally from Washington State, and I moved over to Oregon to go to college and started the job because I needed a job, and I absolutely fell in love with it, and it turned into my career.
And what did you study when you were at college? Just curious.
I was going for my associates, just in, business associates, just something simple. And then I just started working. It was Cover Oregon back then, but I've stuck with it, and I fell in love with my job. I fell in love with the work that I do and the people that I work with and serving the communities. And I just fell in love with it, and it turned into a career.
The next part of the interview takes a look at how this job and how becoming an assister and or an insurance agent or just navigating the website, how the marketplace makes a difference and really connects people to resources. Purpose, what is the big purpose of the marketplace?
Yeah, so the Oregon Health Insurance Marketplace, what it does is it empowers Oregonians to improve their lives through local support, education, and access to affordable, high-quality health coverage.
And so if they can't get into the Oregon Health Plan, this is where they need to go?
Yes, absolutely.
Okay. And just before we dive into what it does every state have a marketplace?
So yes, every state has a marketplace. Whether they have their own depends. Some states do have their own marketplace where they manage their own enrollments and application processes from beginning to end. Some states utilize healthcare.gov, which is the federal platform, and the federal technology for applications and enrolling in health coverage. Oregon is a hybrid. We actually do both. So what we do is we use the federal technology for applications and enrolling in health coverage, but we at the local state level and our state program oversee the plans sold on the marketplace. We conduct our own outreach and education, and we help the consumers through our state program.
So who exactly should use the marketplace? Let's dive into that a little bit deeper.
Yeah, that one's a really great question, actually. So anyone who's not currently insured and is not offered coverage through a job, not offered coverage through the Oregon Health Plan or even Medicare, should definitely look at their health coverage options through the marketplace. Self-employed people, independent contractors, small business owners, and part-time employees and other contractors are actually 3 groups of folks who can also shop through the marketplace, likely with significant financial assistance. And additionally, people who lose health coverage from their job should compare marketplace health plan options with their Cobra coverage that's being offered to them before enrolling in Cobra, because likely they'll find a health plan that's just as good, if not better, and at a much lower cost than their Cobra.
So that's a lot of information here. So let's break this down a little bit. some people might not be familiar with the term Cobra, so we're going to start with that at
Okay.
the end, and then work backwards. So, um, tell in a couple of words, a few sentences, I should say. How would you describe Cobra?
So when a person separates from employment, their employer offers them the coverage that the employer offered them during employment,
Mm-hmm.
but the person that's separating from employment has to pay the full cost of that. The employer doesn't pay towards that. So the full cost lays on the previous employee. And sometimes that can be extremely expensive.
And so Cobra allows them to continue that health insurance and pay into it for a certain amount of period of time. And so that might be really cost prohibitive. And so people would need to think about, okay, you do have options. And I think that's interesting for the United States. How we do our health insurance is different than other countries. And we really use this kind of a combination of public and private. And so when someone's not employed at a full level, they or their let's say their employer doesn't provide health insurance at a certain level. They don't have enough hours to get full health insurance. Um, is it possible for someone to be employed, partially employed, and not receiving insurance through their employer to use Marketplace?
Oh, definitely. Absolutely. And depending on their income and household size, they may qualify for a significant financial assistance package that can help them lower their premium costs as well as their out of pocket costs when seeing providers.
Okay, and so, and I'm gonna, so I get that now. It's like the safety net.
Yeah.
So it's a safety net for those people who are partially employed or are falling in between the gaps after they've left their employment and they might not qualify for the Oregon Health Plan. Um, and you said Medicare. How,
Correct. Correct. So, for example, people who are here that have not worked enough hours may have to pay for Medicare Part A. And if they have to pay for Medicare Part A, they can actually shop on the exchange and still potentially qualify for financial assistance.
and I think someone right now, if you went to another country, you would probably you'd hear little bit different moving. We have a lot of moving parts in the United States,
We do.
a lot. Um, so I think one of the big things, when in doubt, and if someone doesn't have health insurance or is lacking coverage, when in doubt, check the Marketplace.
Yeah, absolutely. We're open. Our call center is open Monday through Friday, 8 to 5, toll-free number. We have an info box that people can email and ask questions to. Yeah, and we're always happy and willing to provide assistance and help them, be able to obtain the health coverage that they're seeking and explain the process and explain what it all means. Oftentimes, we may even help people through the application process themselves so they can better understand it. And that's also where our window shopping tool comes in, which I'll show you on the website in a little bit.
Okay, good. So we got the website up. Go ahead. This is perfect. Now we understand what's going on. Now you've talked about this we're here. Tell us a little bit about this website.
So our website is oregonhealthcare.gov.
Mm-hmm.
And on our website, you can find free local help from an expert. So that will actually take you to a page where you can put in a local zip code and then search for marketplace agents or brokers, and then search for help. And it pulls up a map of the closest agents to that specific zip code area, as well as all of their information for their address, the county that they serve, the language they speak,
Mm-hmm.
or help provide assistance in certain languages, as well as their phone number and email address. And a person can just contact one of them and let them know they need assistance with the marketplace. And the agent and broker's assistance is completely free to the client.
And so the number of different agents it's not it's for convenience for that person to be able to talk to them and go meet with them in person.
Yes, absolutely. Like Right now, of course, during the pandemic, a lot of in-person assistance is closed or limited, but they're
Mhm.
still available by phone.
Okay, got it. And can you scroll back up again to the drop-down menu there?
Yeah.
So,
So
yeah, well, that's interesting.
yeah, they can, if a person's looking, like if they're not eligible for Oregon Health Plan, they can search for marketplace agents. They can also search for Oregon Health Plan community partners.
Hmm.
They can search for agents that assist the Medicare population. They can search for Sheba and Medicare volunteers that can also assist with the Medicare population and help answer any questions regarding Medicare. And there's also a small business search for people that have small businesses and few employees that may be able to um, purchase coverage as well to provide for their employees if that's something they're wanting to do.
So this is, and go back to the top of the website again. Okay, so OregonCover.gov, and
Yeah.
and then find, look, they need to come in through find local help. Got
Right.
it.
The find local help is can be found at the top of the banner right here, or
Mm-hmm.
the middle of the page. It's in
Got
both
it.
locations.
Okay, got it. And then they go to find local help, and then they would check marketplace to drill down specifically into the marketplace.
Mhm.
But this also is also a search engine for the for Oregon Health Plan and Medicare, and the other areas too. But marketplace, they come in and then they have an agent that will help them with the
Absolutely.
marketplace. Okay, now um, they've done that. I guess the next big question is, um, what other tips do you have for
So
them?
another tip that I have would be to navigate our window shopping tool, which from our homepage is
Mm-hmm.
right here. It says not sure where to start. You can window shop. And currently it's window shopping for 2021 coverage because that's the current year that we're in.
Mm-hmm.
And you just put in simple information. And if we're looking for coverage, and then you would just answer, specific questions if you're looking for tobacco, or if you use tobacco, if you're a member of a federally recognized tribe, or if you're pregnant. And then the most important question is, would you like to find out if you can get help paying for coverage? And we want to select yes there.
Mm-hmm.
And there's only one person in this scenario's household, employer coverage is not available if that is
Mm-hmm.
the case.
Mm-hmm.
And then they would answer yes or no to receiving unemployment benefits in the year 2021. And then we're just going to put in that the expected annual income for this scenario is $35,000. Oh, county to shoots. There we
Mm-hmm.
go. And what it does is, based on that basic information that I put in, it will display the potential amount of premium subsidy per month that person could qualify for.
Mm-hmm.
And then, so going to continue, it actually takes you to preview the plans that are available on the marketplace. And looking at these prices, you can clearly see that it's $304 subsidy applied to the actual premium amount would only leave that person to pay $22 for this specific plan that's showing on top.
Mm-hmm. Oh, okay. So the subsidies are coming in for
Yes,
someone
it
at a certain.
automatically calculates the subsidy amount. And you can filter it from the side. And you can filter, depending on bronze level plans, and gold level plans, what insurance company they want to go with, if they know which insurance company. But it definitely displays all of the plans that are available to them in that area that they put in on that window shopping tool, and
Mm-hmm.
allows them to get a really good idea on what they're looking at before going through the whole entire application process on healthcare.gov, which is the federal platform that we use.
Okay. And so this is why an agent would be helpful. So let's say someone's
Absolutely.
not familiar with the terms PPO.
Yes,
I know what that is. Um, the people will get taking this class will become familiar with that terminology. But if you're working with a client, they might not be computer savvy or familiar with the terms. You get
absolutely.
lost in this, right?
Absolutely. So we always highly recommend connecting a client with a local organization who offers that assistance, or a local insurance agent or broker, and building that referral network. So, as your CHWs get trained, if they run into somebody that may not have insurance, that's not eligible for like the Oregon Health Plan, then
Mhm.
they can know where to send them, so they're not stuck in that loop.
Exactly. And that's why you started with connecting them to the agent.
Yes,
Um,
absolutely.
but it's great to see this tool because let's say you've got someone who really is savvy and wants to dive into, and it creates transparency too
Absolutely.
of all the. I understand why this is here because you want to see um, what your premium would be or what's being subsidized and how this could change. And I like how you put good year, bad year, average year, because based on what's happening in someone's life, there's such thing as being underinsured. Sometimes people can be overwhelmed with medical bills, you
Yeah,
know?
absolutely. Absolutely. And medical care is expensive.
Yeah, it is, isn't it? Um, definitely. And the United States has the most expensive healthcare in the world. So we really need to be very savvy about how they're approaching health insurance and making sure that they're getting the best fit for them so they're not blindsided by medical bills.
Absolutely. And the insurance agents are the ones that are licensed to do that.
Okay.
We have plenty of insurance agents located in the Central Oregon area, and we have them dispersed statewide also.
Okay, got it. So
There are
really
quite a few that are in Central Oregon, and they're all amazing to work with.
definitely use the agents because someone CHW doesn't who's working with clients shouldn't feel like they have to know all this stuff. They just need to know to really connect them to an agent. So that, but it's great for them to be aware of this so they can kind of talk about it and really make that connection and understand, be able to talk about the importance of all this. So what types of tips would you like to talk about for specifically for a CHW now, for a community health worker, and connecting people to resources?
Absolutely. So, if a community health worker ends up in an organization that does not offer financial or offer application assistance, again, we heavily recommend connecting their client with that local organization who does offer that assistance,
Mm-hmm.
health insurance and agent or broker, and building that referral network. They can also consider becoming an application sister themselves. And
Okay.
if that's something they would be interested in or learning more about, they can email us at cp.marketplace@oregon.gov, and
Oh,
we can
good.
connect them to that information.
So, in summary, this video covered what is the marketplace and who is it for, how to navigate the marketplace, how to reach an agent, and then tip for community health workers or someone who wants to connect people to the marketplace. If you have any other questions or would like more information, here's the contact information for Carolyn Black, especially if you're interested in becoming an assister. That is it for this video.